It has been 8 years since Canada legalized MAiD, medical assistance in dying. Each year since then, we've seen a growing number of people requesting and receiving MAiD in BC. The provincial government says in 2017, 677 people died by MAiD. By 2020, that number had nearly tripled to almost 1,600. In 2023, nearly 2,800 people chose to end their life by MAiD. When it comes to choosing that option, the vast majority of people are working with their family doctor to end their life. So joining us to talk about MAiD, what it is, what it isn't, and how it works is our medical columnist and family doctor, Melissa Lem. Appreciate you coming in today. So how do family doctors like yourself approach this conversation with somebody who has requested MAiD?
Well, the first thing I want to say, Dan, is that this is a difficult topic for a lot of people, whether you're a patient or a physician, because of the many different backgrounds that we come from, whether it's cultural or spiritual or otherwise. Right now in Canada, across Canada, only about 1% of family physicians are providing MAiD services. So this is probably a conversation that many family doctors have never had with their patients. But if you are thinking about MAiD, the key points for patients to know are that you have to be at least 18 years old to receive it, that this needs to be a choice that you need to make on your own. It's not one that your family member can make or your healthcare professional. Also, you need to be suffering from a serious and incurable condition that's causing a serious functional decline and isn't being treated to a standard that you find acceptable. And also, this is a decision that can take as long as you need to make. It's a conversation that could take months. You can change your mind at any time. And it's also something that is important to talk about with loved ones around you so that you can make it in the best way possible.
Now, as we saw from some of those numbers, the number of people, particularly in BC, requesting MAiD has risen. I don't know whether dramatically is the right word, but the numbers are what they are. Do you think the perception around that option, that practice, has changed?
I think over the past 8 years since it's been legalized, it's unlikely that our overall perceptions have changed. It's just that more people are likely aware of it. So we know that over 90% of people are still requesting MAiD because they have an incurable condition with reasonably foreseeable death. And we also know that people, when they do choose MAiD, it's something serious, right? And initially, when people were choosing MAiD, the initial kinds of people were people who were wealthier and who were higher educated, whereas now it's a wider variety of people from socioeconomic classes who are choosing it. And we also have to keep in mind that this is something that's still fairly relatively new. So, of course, as more people learn about it, we're going to see higher proportions of people requesting it.
And lastly, we appreciate your time. So much of what a doctor does is promoting health and keeping people alive, perhaps prolonging their life, improving their life. What changes when a doctor is assisting someone to end their life?
Well, whether we are helping patients with choices around managing their current care and living with certain health conditions or dying with them, what's central is that patient dignity is at the center of those conversations. And also we have to respect patients' choices over their own health care. So, for example, when we have these conversations, they can take weeks to months sometimes. And it's really a conversation that gives us the opportunity to talk to patients about what their values are, but also advocate for better care. It's true that across Canada, we don't have equal access to palliative care or caregiver networks. So what we have to do is make sure that we invest in them more and advocate more for our patients so that MAiD doesn't become the default option for someone who would really prefer another kind of care at end of life or when they're suffering.
Dr. Melissa Lem, we appreciate your time and your expertise as always. Thanks for joining us.
Thanks, Dan.